CBCT switch and wait for it to start. Turn on the computer host. Open the FinScan imaging software. Enter the password to access the FinScan imaging software. Create a new patient record. Click on the patient information just created and select the shooting mode. Performing panorama mode shooting. Access the panorama imaging interface. Set the scanning parameters. If there are implants or other high-density objects in the patient's mouth, please select Denoise. Click on the Prepare button. Once the preparations have been made, begin patient positioning. Before shooting, ask the patient to remove earrings, studs, glasses, removable dentures, and other items, and place them in the storage shelf below. Guide the patient to properly wear the lead apron and lead collar to avoid artifacts. Once the patient is ready, guide them to stand correctly according to the instructions. Cross their hands and grasp the lower armrest. Adjust the height to the appropriate position. It is essential to closely observe the movement of both the patient and the CBCT during height adjustment. Ask the patient to gently rest their jaw on the jaw rest, and to bite the notches with their upper and lower central incisors. Turn on the laser positioning light switch on the touchpad. Guide the patient to keep their head upright so that the laser beam can align with the center of their face. After adjusting the position, rotate the adjustment knob next to the touchpad to adjust the temple area head support and secure the patient's head. Utilizing the Frankfurt horizontal plane for laser alignment. Ensure that the laser beam aligns with the top of the ear canal and the lowest point of the eye to position the patient. Ensure that the head support at the patient's temple area is properly fixed. If needed, adjust the laser beam to reposition the patient's canine teeth while positioning the patient with the laser light. Ask the patient to close their eyes. Avoid looking directly at the laser beam. Ensure that the patient's head is properly secured by the head support at the temple area. Keep the neck slightly forward and maintain a standing position. After patient positioning is complete, ask the patient to close their eyes before taking the shot. Turn off the laser positioning light. After patient positioning is complete, click on the Start button to start shooting. Push the exposure button according to the instructions. Release the handle according to the instructions below. Wait for the image to be reconstructed. After the imaging is complete, double-click on the patient management interface to view the acquired images.